This is Dr. Wycliffe Baird, and I'd like to talk to you today about the science of disease transmission, specifically as it applies to COVID 19. If we are to understand the science of disease transmission, there are three important factors that we must consider. One, the agent. In this case, it is COVID 19 or it could be any other causative agent. Two, the host. That is the person who is infected with the agent. That is you and me. Three, the environment. That refers to the surroundings where the agent and the host live before the agent invades the host. Let us first look at what is really happening. This is a war that is being waged. You versus the enemy. There is an enemy or agent in the environment, and the enemy is looking for a host, that is you and me, so that it can survive. Once the enemy enters the host, there is a declaration of war between the agent and the host. Note that the enemy comes with a whole army. There are millions of COVID 19 viruses or soldiers, not just a few. Their sole objective is to invade healthy cells of the host, multiply, do damage, and eventually destroy the host. This damage can result in illness of the host with a wide range of symptoms of the host, including death. Or it may be that the host has a strong immune system, is able to overcome the agent, and the host gets no symptoms or very mild symptoms. The agent usually has a target organ, and in this case, it is the lung. This is the battleground. This is where the war takes place. This is where COVID 19 does its damage. Now let us look at the agent, COVID 19. This is a very aggressive and powerful virus that comes with a lot of ammunition and artillery. It is ready and able to cause illness or death. Its final target is the lungs, and that is the ultimate battlefield. This is where it does most of its damage. It is spread primarily by droplets from coughing, sneezing, or speaking, and enters your system via the nose, throat, or eyes. Hence the importance of practicing physical distancing of at least 6 feet or wearing a proper mask and goggles. It can take anywhere from 2 to 14 days before the host develops any symptoms, and during this time, the host can transmit the virus to another person. Hence the importance of self-isolation. Stay home. This is the most effective way of stopping the survival of the virus. It needs to spread to another person in order to survive. But the enemy does have some inherent weaknesses. It can only survive on open surfaces for 6 to 12 hours. Hence the importance of wearing gloves or cleaning public surfaces that you are likely to touch. It is killed by soap in 20 seconds. Hence the importance of washing your hands with soap for at least 20 seconds. It is killed by 70% alcohol almost instantly. Hence the use of hand sanitizers with at least 70% alcohol. If it manages to get into the stomach, it may cause some mild symptoms like nausea, vomiting, or diarrhea, but it does not survive well in the acid environment of the stomach. Its favorite spot is the lungs. So much for the agent. What about the host? What about you and me? Are we prepared for battle with this invading enemy? That depends on a number of factors. Young persons are generally less likely to be overcome by the enemy than older persons, but young persons are not immune. But the most important factor that will determine if you will overcome this agent is the state of your immune system. A healthy and well-tuned immune system is ready for battle and has a good chance of winning the war. Hence the importance of taking immune system boosters. This ensures that your body has a powerful army with skilled soldiers that are ready and able to conquer the enemy. Yes, this is a declaration of war. If the host loses, the host dies. If the host wins, the host is left with soldiers that remain in waiting in the event that this enemy returns in the future. And these soldiers may provide protection from any future attacks of this agent. In the case of COVID 19, we do not know how long these soldiers, or antibodies as they're called, will hang around and give protection or immunity to the host. In fact, we're not certain how many or if any antibodies are formed. The presence of premorbid or predisposing illnesses will make the host more susceptible and more likely to be overcome by the agent. Therefore, a host with chronic diseases such as diabetes, hypertension, TB, HIV/AIDS, chronic bronchitis, asthma, cancer, etc., is more likely to be overcome by the enemy and become ill or lose the war entirely and die. Finally, one has to consider the environment. Is the external environment more favorable for the agent or the host? COVID 19 survives better in cold rather than warm weather. It lives longer on hard and metal surfaces than on porous surfaces like wood or cardboard. The availability of a proper healthcare system with well trained personnel and adequate facilities will often determine the outcome of the struggle between agent and host. Respirators and ventilation supports are critical in the case of COVID 19. I hope that this gives you a clearer understanding of COVID 19 and the interplay of dynamic factors that are involved in the science of the transmission of this disease. Thank you very much. And this is Dr. Wycliffe Baird wishing you well and wishing you good luck in your fight against COVID 19. Thank you.